So eyelid cancer surgery is done in two steps at least. One step is to remove the skin cancer in a fashion that is fully removed so that the risk of recurrence in the future is very small. And once you have completely removed the skin cancer and you're happy that there's no residual cancer, then you would go ahead and repair the defect in the eyelid or in the adjoining facial structures. So the procedure, as I said, because it's done in steps, the first step, which is removal of the skin cancer and checking for clearance, can take anything between 1 to 2 hours, sometimes even longer if the histological analysis of the margins takes longer. But it's usually about 1 to 2 hours in sort of day-to-day cases. When it comes to reconstruction and repair of the defect that we have following the removal of skin cancer, and then again, it's anything between 1 hour to several hours, depending on the extent of defect. But for daily sort of routine work, if I may say so, it's I would think you would allow one morning or one afternoon for the whole procedure. So you come to surgery for a morning, you have skin cancer removed, check the margins, make sure it's clear, and have it reconstructed and go home around lunchtime, or the same thing in the afternoon. So half a day is usually required for removal and reconstruction under local anesthetic, which is the routine sort of work. If you do the procedure under local anesthetic, meaning that patient is awake, then we need a local anesthetic to numb the area. And I always tell my patient that's always the worst part of the procedure. Once everything is numb, then it's a lot easier. But there are many ways of reducing that initial pain of the injection by improving technique, using adjunct techniques, and all of that. So the purpose of reconstruction for eyelid cancer surgery is to maintain the eyelid function and to maintain the appearance of the eyelid. So if the defect is small enough to the extent that we think if we leave it to heal, it's not going to disturb the function or the appearance of the eyelid, yes, it can be left. But usually a reconstruction, a nice reconstruction, is required to facilitate that healing process. So although it can be left at the very small defects, but it's not a common scenario. So the potential side effects and risks of a procedure like this, so we remove the skin cancer and we endeavor to fully remove the skin cancer, but there's always a very, very small chance of recurrence in years to come, or chance of developing new skin cancer. In terms of the following reconstruction and healing, everybody heals differently. So there is a risk of scarring, risk of deformity, and things like that, which can be addressed. So sometimes, although most often the one reconstruction is enough, when the defect is extensive, you might have to have revision surgery and further steps to achieve an improved outcome.